Hi, and welcome to the first of a series of Kalari discussions, where I will be interviewing a series of very interesting guests. Today, we are joined by Pugal Rajendran, who is a physiotherapist qualified in Tamil Nadu, now working in the UK. Welcome, Pugal.
Thank you. Thank you, Adam.
So we're going to
Um,
be, sorry.
no, carry on. That's
We're
okay.
going to
Yeah.
be talking today about a few things, but the aim of these talks is basically to prepare us for the release of the iPhone and smartphone application that we're going to be bringing out very soon. What we want to really do is just to plant Kalari in the context of physiotherapy today, to look, how useful are the exercises, how much validity is there behind the Kalari as a way of training. So we'll be looking over these next talks. We'll be speaking to doctors, Ayurvedic doctors, dietitians, and a few other people who I think can give us a good context for Kalari. So, Pugo, maybe you can just give us a very quick bit about your background. I know that you obviously trained in India, in Tamil Nadu, the neighboring state to Kerala, where I trained in Kalari, and you came to the UK. Since then, you've been training and done internships in neuro rehab, cardiovascular, the Burns Unit, Cancer Institute, accident and trauma, and musculoskeletal. And you have your own clinic, right, in West London?
That's right. Yes. I moved to, I've trained in back home India, so, which is in Tamil Nadu eventually. I came to UK in 2009. Since then, I've been registered with the Healthcare Professional Council, HCPC, with the UK registration body. And I've been working as a physiotherapist here. So, and I was working with various NHS hospitals, nursing homes, and residential homes, and a community settings, local clinics with the GPs. So I worked in a different sort of a range of settings since 2009. And recently have completed my I'm about to complete my MSc in musculoskeletal medicine now.
Great.
So which I got my diploma, which is about the dissertation, so about to go. And so where I'm actually specializing in, how to do the joint injections, intra-articular injections. So the PRP, the recent trends of stem cells therapy of PRP injections, steroid injection, hyaluronic acid injections, and analyze the efficacy of various injections. So what is it doing inside the joint? So that's all I'm just doing it. So I'm just about to finish it MSc now.
Great, great. Okay, so yeah, so you've been looking at research particularly on that, have you?
Which I'm going to, once I completed my MSc, I'm planning to take my PhD on something related to the musculoskeletal area,
Mhm.
but still on my pipeline. So because a lot of other stuff which I'm doing currently, running my own practice, which
Yes.
my caseload, yeah, it's on the pipeline. So hopefully it should be settling in very soon.
Great, great. So, I mean, I first met Pugal some years ago when I was temping in hospital at you. I also temping in the same hospital.
Right.
And as well as his encyclopedic knowledge of anatomy, which was useful to everyone in the department, what struck me about Pugal was he was doing these techniques which had a very quick response from the patients, right? And they reminded me of some of the techniques that I'd learned. So it was very interesting to have that meeting early on. Um, we've got a few questions that we'll go through. The first one
Sure.
was just kind of look at some principles, which are important principles in Kalari. And I just wanted to see, if they were also, in your view, important for an athlete to train in, even a kind of lay athlete to train in. So the first one was the importance of core muscles. So we work a lot in Kalari for that. I mean, how important is that? And could you explain perhaps why that's so important?
Um, so like the core muscle, as we say, so the name itself is explains. It's actually core. So which is eventually very important and is a foundation for almost all the movements. It provides a stability for the spine, pelvis, and transfers the power and the powers between the upper and lower limb and helps to prevent the injuries. Is mainly the core muscle strengthening, which is the literal terms weak core it can cause the poor mechanics, biomechanics, and the higher risk of injury, which is especially lower back, hips, and knees. So the essential for all the sports, especially people who involving in running, jumping, throwing, or any contact sports. So they have to underline the word. They have to just to have a very good core muscles in order to prevent the injuries. And also not only that, like basic the housewives who is actually standing in for a long time,
Right, right.
like cooking and all, and also people who are actually in a teaching profession, physiotherapists, doctors, and the people who are actually in a profession who can stand a long time, so they're actually prone to get a sort of the core muscle weakness, so then can easily develop, especially postnatal. So after the delivery, either it is a cesarean or either it's a normal delivery, that's a core muscle. It's first thing it will go weak. So it is mandatory for them to just to concentrate a core muscles, because that is an initiator. So because when a people comes with the knee pain or a hip pain, so normally we assess the core strength to just to see how much grade they contributed to having the issues on the hip and knees. So yeah, core is everything, and it is a foundation for almost all of the movements of our body. Yes.
Right, right. Yeah, I remember years ago when I first started Kalari, my teacher, his oldest son, who is also a physiotherapist as well, he said to me, Adam, the two most important exercises in Kalari are the first posture, the elephant, and the first leg swing, the first kick. Now, in the first posture, you're basically engaging the whole core, right the way from the lifting of the foot all the way up through into the masseter. Yeah, so that whole front line gets engaged. So you're saying that, yeah, this is important whether you're an athlete, whether you're just spending the day on your feet, whether that's in your work or in your sort of home duties, and of course, if you're elderly as well, right? And it's also
Correct.
yeah. So all the way through our lives, very important. So yeah, from day one, this is something that Kalari is on, which that's good. Okay, we're on the right track. Okay, so the next thing would be then ballistic stretching now, or ballistic exercises in general. I mean, just if I explain that to our viewers, what that is, it's when you're using the weight of the joint the weight of the limb to pull on the joint. So whether it's swinging of the arm or swinging of the leg, you can swing the limb and it will pull gently on the ligaments and I guess into the joint capsule. Is that right?
Correct. Yes. It's mainly ballistic stretching, which is used with caution always. So
Yeah.
it involves on the fast bouncing movement to push the joint beyond its range. So,
Right.
for example, rapidly swinging your arm. So I would say usually this can be reserved for advanced athletes. So
Yes.
because
Yes.
eventually it's people who are actually starting to become an athletes,
Yes.
I wouldn't actually recommend the ballistic stretching would be an ideal option, because we are actually pushing the joint beyond its range. Sometimes it go for an injury. So it can be risky,
Yes.
especially if done cold or improperly, as may lead to a muscle strain or tears. So like I would say that this can be effective after a complete warm up. This cannot be used as a warm up, definitely, but
Yes.
this can be used after a warm up to improve the flexibility, because once the muscles are warmed up, you're actually on the right track, doing it in a proper way. So then eventually can increase the flexibility to a minimum degree, but without supervision. And I would say it's straight away with the caution. So
Yes.
ballistic stretching can be avoided,
Mm.
and can be useful for specific sports such as martial arts, gymnastic, because those are actually the sports where we can just like bend and flex. There are so many of our joints can go beyond the range.
Mm-hmm.
So in a well conditioned and well supervised by a qualified trainer to just watch you, so how much you can just do that, because that could potentially can cause up to fracture, like mild sprain to up to maximum to fractures.
Yes.
So not important for general training, limited to advanced athlete in a specific sport, such as I mentioned, some martial arts and gymnastics. So caution to be taken when we talk about the ballistic stretching. So which is it should be always supervised. I would highly recommend to be supervised and in a well-conditioned environment
Yeah.
rather than jumping from the wall to the floor. So you'll be end up on having a fracture. So basically, it needs caution to be taken.
Yeah, absolutely. I mean, we do warm up before. So we have in Northern style Kalari, traditionally they would actually start with the kicks pretty much. But you've got to contextualize that and say that these are guys who are training every day and they're living in the subtropics and they're putting oil on their body. So it was much easier for them. Oh, and they've started when they were 6 as well. So so very different. So when I bring it into when we in the app and with Kalari Lab, when we're teaching these, we always do the warm-ups before. And I always say to the students, not to throw the leg hard, just to let it go very easy. Because as soon as you go hard, people are doing this. And so it's
correct.
clear that, people are overexerting themselves. And as you say, then it's very, very easy to strain or even worse, to fracture, to pull and break off a bit of the bone, right?
Absolutely.
Break away, more likely. Yeah. So to be done with caution. This is a very, very important point, I think. Yeah. Okay. So the next is plyometrics. Perhaps you'd like to. I did the last one. You can explain to people what plyometrics are.
Okay, so it is very important for power-based sports, which develops explosiveness, speed, and neuromuscular conditions and control. Basically, the jump squat, box jump, and then clap push-ups, like the push-ups when they are just doing the clap push-ups and overhead throws. So those offer the explosiveness and the speed, which is contained a lot of neuromuscular control, especially important for sports involving sprinting, jumping, rapid direction of a change, football, basketball, volleyball. So these kind of athletes, mainly, they have to concentrate on plyometrics, should be implemented progressively to avoid overuse injury, not start straight away. I'm going to do a plyometrics today. I'm sorry, definitely my clinic is open. You can come and visit me anytime.
We'll be sending everyone to West London. Yeah,
correct. Yes, it always has to be a progressive. It start from a minimum, then intermediate, then you can go to an advanced, and great for performances, but needs a proper foundation, which is a proper strength to be utilized and used, and a proper technique should be followed.
Yes.
So without if you don't have a proper strength, don't go for a plyometrics. In order to take that explosiveness and the speed. And also you need to use a proper technique to do plyometrics. If you're not strengthened technique, it is an important key point of while you're trying a plyometrics. Otherwise, it's definitely could be a potential injury. So yes, it's mainly for the rapid contact sports, football, volleyball, basketball. Players should concentrate. Yeah.
So I'll ask a moment about what would be the use of these, in terms of what it gives an athlete. But just before that, just so you said about technique. So one of the things that I'm quite strong about is it's how much I stress alignment. And I've been looking recently at some of the research behind this and the importance for alignment in athletic movement, and how when the body's not aligned, particularly the pelvis, when the pelvis isn't aligned, and then you're moving, and then you're going to get this forces going into the joints out of angle, right? So this can be very important with plyometrics. I would imagine for the same reason, right? That if you're putting a strong force into the joints when they're jumping forwards, jumping down or jumping up and landing onto the feet, if things aren't in line, then they're going to get slowly, they're going to get wear and tear in those joints, right?
Correct. Yes. Right. So, that's what I just mentioned. The technique has to be a proper technique, even though you just do a jump squat. We talk about proper jump squat. So the landing, foot position, knee alignment, hip position, and how the upper body should move, and what your upper body limbs should be in position. This all need to be in a coordination. So when this coordination disinterrupts, so what will happen? The force, the ground reaction force, whenever you're jumping, the equal force according to Newton, the third law. So every action, there is a reaction. So whenever you're just stamping a feet on the floor, exactly the same ground reaction force, it will come back to your joints. It has to travel into the same COG. So the center of gravity, it should cross through. if you're not actually doing it in the right way, as you mentioned, that the force can be hit in a wrong place. Eventually, it can cause us wear and tear or could cause a potential injury. So, caution to be taken. That's what I again said. It's strength, the proper strength needed before you try plyometrics and a proper technique to be used.
Yes, exactly. So, first training to develop the strength in the student through posture training and through isometric tension, perhaps, holding the body in positions where the muscles are getting stronger and moving softly through positions, and then going into more plyometric exercises, right?
That's right. Yes.
Right. Again, this is reflected in the syllabus, if you like, of Kalari, because the first things that we learn are postures. Then the first forms that we learn are soft movements, and only later we go on to these more sudden, strong movements. When the student, usually I would wait. I mean, if I had a student for a few months and we were training 5 days a week, I'd probably be 7 weeks, 8 weeks, depending on the age. If they were young, could be sooner, but if they were older, a bit too old, above 40, 50, you might wait a bit longer for the body to be ready for that. Good. Okay. And so then just to stay on this point a moment longer, what would be the advantages for the athlete to do these plyometric exercises?
Yes, it's especially for the important for a sprinting, because especially the sports sport persons or footballers or basketballers and volleyball. So as I mentioned, this is actually a contact sports, and they are changing positions suddenly. So it is there is no actually a specific pattern they have to move in this direction, because if you just see cricket or any other sports, then the direction has to be which way. But when it comes to football, volleyball, it can be a sudden changes of a direction. So you need a muscle coordination. So the plyometrics, it improve your strength, endurance, as well as the muscle coordination.
Right.
How to prevent your joint going beyond the range. It's training and build up a muscle memory. So which is because as I'm a physiotherapist, if I just take even in badminton, if I just take a shot, so then I know if I just even move a little bit more, then I will end up on hurting my back or hurting my hip or knee. So this plyometrics will teach you that. Yes. So this can actually be helpful. I'm sorry, I can't actually turn my knee beyond this degree. It can cause ACL tear. So I can't actually go beyond this range. My ankle can break. Sorry. There are so many things that it can develop in this plyometrics. So that is an advantage of gaining an insight about their movement.
Right. So
it's how to. Yes.
Sorry. So it's going to increase your proprioception, and it's going to make you aware of your body. Absolutely. Correct. And this is like the book by Philip Zarelli on Kalari, which took the title from one of the old lines of poetry, which is written in the manuscripts, which is translates as "When the body becomes all eyes." And this is kind of what we're talking about, right? When the joints, yes, they become aware of each other. That's proprioception, isn't it? Right, our body.
Correct. Absolutely.
Right.
Yes.
Okay. So we're again on the right lines. Okay. Good. Okay. We'll move on from this question soon, but just a couple more things. The strengthening of the synergist muscles. So I mentioned before that with posture training, I think we're particularly working on this when the joint is held so that there's no change in the muscle length. So we go into a position which requires a lot of effort to hold that position, and then you hold it, and then so that then the joint, the muscles become stronger, and the synergists then will get more engaged. Is that right? The smaller muscles around the joint.
Correct. Yes. First of all, we need to just give a little bit of introduction about what is synergy muscles are. So, synergy muscles are they are not a prime movers. For example, if it is a shoulder flexion, so normally the main muscles are anterior deltoid, pectoralis major, biceps brachii, coracobrachialis. Those are the main muscles which can actually brought a flexion action. But synergy muscles, they are not prime movers, but they help the prime movers to get the joint stability. Right. So for the same shoulder flexion, serratus anterior and upper trapezius. So those two muscles are the synergy muscles, which is we call it actually a clerk muscles, which is like a prime movers, the managers are in the front, and the prime
I
mover,
see,
the
I see.
synergy muscle, just assist them to be gaining the stability. Because when the synergies are not working properly, the manager will get the stress.
I see. Yes,
Exactly.
that's a good way to think about it. Yeah.
Exactly. So, neglecting these muscles can lead to a muscle imbalance and an injury. So, which is again, as I said, it's a stability muscle. Synergy muscles are stabilizing while the prime mover is doing their duty. So, when we are not actually, because most of the people are especially doing this big mistakes in gym or a weight training, so they mainly concentrate on how to train the prime movers,
Right.
but they forgot about how to stabilize your synergies. Because when you stabilize your synergy muscles, and the actions that you're making to bring up your prime movers can be easy,
Right.
but they don't realize that. So this is the reason. It's out of, I would say, 20 to 30% of cases in my clinic, it's a problem with the synergy, not with the prime movers.
Interesting.
Yeah.
Okay. Okay.
And and a critical for injury prevention and the balanced movement pattern, it is also a part of a synergy's actions. So don't prime movers are important, but equally synergy muscles are also important to be trained in a proper way.
Right. So actually, if I'd introduced these sub parts to this question in a different order, it might have been better to have brought this higher up. Because when we talked about certain things that need to be instilled in the body before ballistics and plyometrics, this was
Correct.
one of the more early ones, right? Getting those
Correct.
systems working from day one. So
Correct. Yes.
along with the core, so, and again, that's what we are doing. In fact, when we're doing the posture training, which is when we start with new students, they're doing posture training, and they're doing the slower forms where they're holding the postures for a bit longer. And so they're getting the opportunity then to stabilize through the synergists and to strengthen the core. And then
Absolutely.
later we come on to the more demanding things, right?
Correct. Correct.
Okay, great. Flexibility. So you touched then about the gym, and you said that one of the problems with the gym is that people are not developing their synergist muscles as well as they might. And my observation was always with the gym is that people didn't stretch enough. So that how important do you think flexibility is? I mean, almost maybe too simple a question, but I think it's
Yeah, no, absolutely. That's because when we talk about musculoskeletal, or when we talk about the calories burning and all, but definitely the flexibility, flexibility and strength, it's an important area. We cannot actually miss it. So flexibility without the strength, okay, it can create a poor joint control,
Yes.
and it can lead to injury risk.
Yes.
So, and also the strength, it's without the flexibility, which can restrict the movement, and the compensation actions can happen, and it can eventually strain the muscle. So I would say muscle flexibility and strength is always together.
Yes.
Cannot be actually omit the
At
other.
the same time. Yes.
Exactly. It's directly proportional. So balance the flexibility and strength, then only we can just achieve the optimal performances, which what we desired for, and also reduce the injury of risk. So one of the most essential principles in any long-term training program, flexibility and strength, it's actually plays a vital role. So, so as I said, we shouldn't be confusing ballistic stretching with the flexibility. Okay,
Yes,
ballistic
sure.
it completely go beyond the range,
Sure.
and also the sudden and a fast-paced movement. But flexibility, it's we are talking about like how much we are maintaining an optimal length of our muscles. That is called a flexibility. For example, I'm saying like if it is 10 centimeter, your muscle can stretch, but you go up to only 6 centimeter. That means your 4 centimeter your lag.
Yes.
So which is actually where the flexibility reduces strength, but the strength is good, but there is no flexibility. What will happen? The joint movement will be restricted. So eventually, whenever you're taking a step, the particular muscle action, it cannot be completed because the muscle is not working with its full potential.
Right.
Eventually, because only working for a 6 centimeter, but the 4 centimeter is still lag. So eventually the compensatory action can happen.
Right. Right.
So that means we are using unnecessary synergy muscles. rather than the prime movers eventually can cause strain. So this is a kind of a cycle. So you need to maintain a strength as well as the flexibility is directly proportional.
Yes.
So yeah,
And so,
but people shouldn't be confusing about it anyway with the ballistic stretching.
yes, yes. So just to clarify that for people, so you're saying they should be able to go into a stretch and to hold it without rather
Correct.
going in and out of it. Would be
Correct.
kind of looking at what is actually a proper
Correct.
flexibility.
Yeah.
Yeah, because that's a comfortable stretch. So it's not
Correct.
pulling crazy on.
And because that might eventually cause a strain. But having said that, they cannot be attained whatever the desired length in one go. So that
Yes,
need a consistency. They need a
gradual,
consistency.
progressive. Absolutely.
Correct.
Yeah.
Yes.
Yeah. I mean, that's one of the things that, I mean, when I have a lot of students that come to me or patients that come to me who have been doing a lot of yoga, and they end up very common is the neck from the too much going into extension in the neck, but also in other joints where they've got so flexible, but they don't have the strength and stability. And then so lack of stability, but too much flexibility, which is what you described, right? If they have
Correct.
much of one and not the other.
Correct.
Okay, so maybe we'll jump on to the next question then. And we touched on this a little bit already. If I go to actually, yeah, the one about the gym. I had a question about the gym. So we mentioned already what might be missing. So my question is, if people are going to the gym, how adequate, how is this enough? Is this sufficient? And or what might be lacking? If they're just doing that kind of training.
I would say the muscle coordination, it is important. Good coordination ensures the efficient, smooth, and controlled movement, and help to prevent unnecessary energy expenditure and compensations. So the key techniques, skill execution is nearly in all sports. So vital for performances and motor control, especially in sports requiring agility, timing, and skill precision. So muscle coordination is another crucial aspect which we have to cannot omit while we're talking about the rest of the areas of muscles. Yes.
Right. So we said that so you're saying that if they're going to the gym and they're working primarily with machines perhaps or free weights, then they're not going to necessarily get that muscle co-coordination.
Yes.
Right.
So because, for example, they just train one sort of muscle, so they have to just maintain a muscle in a coordination. So for example, if they are just training the biceps, they have to train the triceps as well, antagonist. So prime movers as well as the antagonist, they have to just the muscle coordination, then only the desired effect can be good.
Right. And I would think also even if they do some bicep curls and then go and do something for the triceps, then to a degree, yeah, they've done both, but they haven't done it in a kind of functional way, in a way where they're actually using them together. And so I imagine if they could do it in a way or they use them together, that would be better, right?
Correct. Absolutely. Yes.
And at the same time, they wouldn't necessarily be strengthening the synergists if they're working in that way, right? Or would the synergists kick in the same if they were just doing a bicep curl?
Like the synergies is mainly for a stability muscle. So for example, this is all about, like we can do a biceps curls even in the free weights, or either we can just do it in a supported way. So, the which technique that we are using to stabilize your synergies. So just to put less strain on the synergy muscles. For example, if you're doing the shoulder flexion, so the anterior deltoid, you can just do it with that one. But for example, you cannot actually do like that.
Right.
Or you cannot actually go, it's a proper technique. So you need to just keep your hand in a certain position.
I see.
Holding it and support your synergies. And then you are just training your prime movers.
Right.
So unnecessarily you put a strain on the synergy, you are inviting a trouble.
Right. Okay. So again, we're leaning towards it might be better to do a functional exercise that was giving you opportunity to strengthen together.
Absolutely.
Okay.
Yes.
Good. Okay. And of course, we mentioned already about flexibility. Okay. So you said to me that the 20-30% of the patients that come to you are coming with problems with their synergists.
Correct. Yes.
Any other group of patients? comes
We
up?
do have, I would say that my patient load, it's mainly for musculoskeletal neurological conditions. So musculoskeletal, let me explain bit by bit. So if it is a musculoskeletal, mainly back pain, so the lower back pain, it's often due to a poor posture or a disc issues or a muscle strain or sedentary lifestyle is mainly causing the back pain issues. These are the main causes. Neck pain, poor posture again, stress, sitting in front of the computer, looking at the mobile phone all the time.
Mhm.
Shoulder pain can causes rotator cuff injury or a tendinopathy, frozen shoulders,
Mhm.
impingement syndromes,
Mhm.
knee pain, especially runner's knee, patellofemoral syndrome, ligament injuries, osteoarthritis, OA, rheumatoid arthritis, ankle sprain or instability, tendinopathies in the sense like Achilles tendinopathies,
Mhm.
patellar, tennis elbow, golfer's elbow, those sort of a thing,
Mhm.
and postural dysfunctions, forward head, rounded shoulders, pelvic tilt, etc. Those are the postural dysfunction. These are the main cases comes on musculoskeletal area. So
Right.
when we talk about the neurological conditions, stroke rehabilitation, multiple sclerosis, Parkinson's diseases, peripheral neuropathies, nerve injuries like is foot drop, carpal tunnel,
Mhm.
those sort of cases,
Mhm.
and sports injuries, mainly ligament injuries, muscle strain, overuse injuries, rehabilitation after surgery, which
Mhm.
is ACL, MCL, ankle ligament, hamstring, calf, quadriceps, shin splints, ITB, iliotibial band syndrome, stress fractures, ACL reconstruction, meniscus repairs,
Mhm.
shoulder dislocations, and post-surgical, when we come to joint replacement, fracture rehab, spinal surgeries, abdominal and thoracic surgeries, is all post-rehabilitation. And chronic conditions such as arthritis, as I said, fibromyalgia, chronic pain syndrome, pediatric cases. We do have a pediatric physiotherapist working part-time with us, so who can see our pediatric cases, development delays, cerebral palsy, scoliosis, and then balance problem, deconditioning, osteoporotic related fractures. Like those are main cases that normally I see, but it's mainly, I would say, low back, neck pain, knee pain, post surgical. I've just explained all that. So it's a very minimal number of pediatric cases because our pediatric therapist is only a part time.
Okay.
So, yeah.
So the I mean, obviously with the neurological incident, we're kind of going into a different area, but if we're looking at kind of the more kind of day-to-day injuries that come into you, do most of those people, I mean, maybe it's not really easy to say this, but do most of those people, are they doing sports? Are they doing physical exercise? Or, I mean, if we count aside the sports injuries, those injuries that are coming in from musculoskeletal.
To be honest with you, I would say mainly the sports injuries, and it's not only, we cannot actually limit that area, because it's not only the sports injuries. There are other areas, like as I said, housewives.
Mm-hmm.
Like even though they are sitting and watching
Yeah,
television.
that's it. That's what I mean. So those people who are coming into you, I mean,
Yes.
are they when you assess and you see there's something wrong with the knee or the ankle or the elbow or the shoulder, and are you finding that they are doing exercise but not enough, or the wrong exercise, or they're not doing any exercise? What is?
It's a mixture. It's a mixture. Some people, even after they come to us, we'll just give them exercises to follow. So most of them, they just give a holiday weekends, bank holiday weekends. They just give exercise weekends. So
Yeah.
anyway, jokes apart, but people are mainly sedentary lifestyle,
Mm-hmm.
and some people will come, like I just started the gym last week, I don't know, something gone wrong
Right.
after I
Right.
lifted a weight. They are not doing a proper training or a proper technique, as I just said, that the strength is not enough, but they wanted a six packs in a week time.
Right. So. Mhm. So you might, so I would, so that it's fairly common that you might have a client or patient who either isn't doing exercise or jumped into exercise too quick, and that would be a
Correct.
contributing factor. So,
That's right.
yeah. So what would be your guidance then, based on that, as what would be a good amount of exercise for people to be doing if they are not particularly sporting? What's it would be a good amount for them to start with as well? What would be a reasonable kind of time to do and frequency?
Probably, like if anybody wanted to just to start the gym, so I would highly recommend. So them, they have to start a proper warm up and cooling down period. They have to offer much of a time. Do not just get jump into an action. So slowly they have to develop their cardiovascular stability. So they can just do a mild jogging, walking on the treadmill, and then like bring the muscles into action. So basically, when we're doing it, the heart can pump more blood, it can carry more oxygen, because we are eating for nutrition. You need to feed your muscle need oxygen.
Yes.
So
Right.
so you need to feed your proper muscles through your warm-up exercises, and then slowly start with minimum weights. So more repetitions. Start with the minimum weight, more repetitions. Eventually, when the weight goes up, the repetition can be less. So eventually that you can start building your strength, endurance, flexibility, and the strength in the side by side. You have to develop, and also the muscle coordination. So you need to know with the supervision which muscle to tap in and which muscle not to be like worked in. Synergy need to be used for stability, not to be trained. So it can be trained with the proper strength and flexibility. So these are the slow steps you might take. Probably, I would say 3 to 4 weeks. Even it depends on an individual. If they are actually like having been physically active for a long time, they can go up to even 2 months, which is 8 weeks. They can go and slow phase. Slowly they can move on to the intermediate next phase. And then they can move on to the real like the strength training, lifting weights and all. Slowly gradually they have to develop. So they have to just to hold one of the technique as a prime aim. For example, if they wanted to just to maintain their flexibility, they have to aim for a ballistic stretching. So they wanted to improve the coordination. They need to do a lot of coordination exercises with the simple weights. And either they wanted to train their body in a strength and endurance, they have to mainly focus on weights, free weights or controlled weights. But like they have to have an aim in place. So when we put the aim in place, then the objective has to be carefully selected before they are actually moving on to the next step. So the objective has to be reviewed weekly basis. And definitely they need a physio, MOT.
Yes.
Definitely need an MOT to just to check is everything is okay.
Yes.
So that's how they have to produce progress into their the strength program.
Right. So it's baby steps, starting small, building slowly, focusing, giving more onto repetitions rather than trying to take a heavy weight, and being very careful about technique from the day one, right?
Correct.
Ideally have supervision there at least, and try to review it weekly.
Correct.
Well, we've pretty much covered all of that in the app, because we've got a feedback system once a week where you will have a split screen and you will record something and send it to me, and I will mark it and send it back. So we've tried to incorporate that to make sure people don't spend weeks and weeks doing it in the wrong way, which people can end up walking in a very strange way then, all out of line.
Correct.
And we've also tried to really start slowly, and the first lessons are like 15 minutes. And then gradually they get longer as you go, with all of the more advanced stuff left for quite a bit later on in the terms of the demand that it's putting on the body. And so just to clarify, we talked about goals in the sense that that you would have a goal for your training, but whether it was flexibility or strength or muscle coordination. But would I be just right in thinking from what we've discussed that in an ideal scenario, you would be trying to build all those attributes simultaneously?
Correct. Yes. So, like you're talking about going to the gym, right? So it can be.
I mean, this is it. I mean, I was saying about the gym, but really, I guess really in any exercise, because
Your fitness goal and your lifestyle and how you actually use the gym. So that is mainly the important 3 aspects that we need to be focused on. Um,
Sure. Yeah.
I did.
I was using that as an example because many people go to the gym, right? Many people for them,
Correct, correct, correct.
exercise, okay, I'll go to the gym, and
Yes. So,
obviously, Mhm.
no, carry on, carry on.
But
Yes,
then obviously you get with people coming to you with problems, they end up with, because they've jumped into it too heavily.
correct.
But, I'm not completely against people going to the gym,
Mm.
but I think it has its place, right? I mean, it's good to strengthen but obviously if we do just too much of that without the kind of attention to the other things that we've discussed today, then it can
Correct,
it's perhaps in wrong direction a little bit.
correct.
Okay, so last question then. And this is just something I've been reading about because I've been reading about one-sided sports like tennis and cricket, and that it can have some adverse effects on the body. I mean, have you experienced that with any of your clients?
Yes, even myself, even when I started my badminton, so like the badminton is the one side of because the rest of the left side is completely sitting doing nothing so except the movements. So it's a greater problem with one-sided sports. It's mainly for muscle imbalances.
Right.
So like the dominant side of the arm, shoulder becomes stronger, more mobile than the non-dominant side. So core, back, leg muscles may also develop unevenly depending on the movement or the patterns. So over the time, this imbalance can create and having an effect on the posture and the muscle coordination. So
I see.
that is the main problem with one side of the sports.
Right.
And mainly the overuse injuries, I would say, as per my own knowledge and the percentage of the patients come to my clinic, the overuse injuries, I would say about 45% of due to the one-sided sports, because they just come back and say, oh, I played cricket last weekend, my knee is hurting. Oh, I played badminton this week, we had a tournament and my shoulder is painful.
I see.
So it's mainly the causes are more prevalent of cases from my clinic is due to one-sided sports.
That's interesting.
And
Hmm.
yeah, and also reduced the movement symmetry. Like a non-dominant side may also lose strength and coordination
Mhm.
because they started, because of the pain. What they do, they just started using the unpainful side.
Right.
So they just overuse the other side, and they just come back and say like, "Oh, Pugal, I just I've done badminton. My right shoulder is hurting. Fair enough, because I've overused it. Why my left shoulder is work? Left knee is hurting. Why is my left shoulder is hurting? Because the right shoulder is so painful. They are doing everything with the left.
Yes. Yes.
So it's creating, because like if somebody is actually very lazy, don't want to go to work, we are trying suddenly taking a stick and ask them to go to work. So exactly the same thing we are doing it. We are being keep on giving food to one person, but nothing given on the other side. But we are expecting them to work equal level of the other side. Eventually, the muscle couldn't cope up, so they just started showing crying. The muscle will be crying. That is called pain.
Right.
Then only they click their mind. Oh my God, something wrong with my left shoulder. So,
Okay, that's
so
interesting. It's quite a lot. I mean, you said almost half of your overuse injuries that you
correct. Yes,
that's quite a
yes.
lot, isn't it? Yeah. Okay.
And also, the poor bilateral coordination so can also affects the performance and increase the day-to-day activities, lifting, balance task, and mainly postural strain. That is very important area. We have to just think it's a postural strain, constant unilateral load.
Yes.
So carrying a gear, swinging, bowling can twist and tilt the spine over the time and causing chronic low back pain and neck pain. This is called postural dysfunction. Is
Right.
postural strain is
Right.
mainly. So this is all a problem of doing the single-sided sports.
Yes.
So you might have a question for how would you manage it?
Yes.
So
Ask me something.
yeah, so cross training, strength training, mobility and flexibility work,
Mhm.
technique and recovery, like what are the technique we need to do. And
Mhm.
after this technique, how long should I have to wait? Recovery.
Mhm.
So they don't actually give a recovery period at all. They go to a gym, lifting 10 kilos of biceps. Next morning, they go and do the biceps again. So the recovery, so you need to give your muscle to recover from a shock, whatever you do. So
Mm.
Yeah. Do you have a question now?
If someone is then doing, say, if someone is playing quite a keen sportsman in one of these sports, whether it's tennis or cricket or something else, hockey, whilst in that area, in that period of time before they get injured, whilst they are doing this sport and everything is fine, it would be therefore advantageous for them to do something like Kalari, where you are using the whole body together, right? And
Yes.
help to keep everything working together. And then doing that one-sided sport wouldn't necessarily take you to such a point when you get
Correct.
an injury, right?
Correct. Yes. Yes. So they have to just focus on the both sides.
Yeah.
So not just suddenly get into an action. So they have to see the long-term consequences of what they are doing now. So eventually, if you are actually abuse your body with more weights, being sedentary and not training them properly without a proper technique, not a proper flexibility, strength, eventually that the body wouldn't cooperate. So that's why you need to give them up. That's why I keep on telling, like, the warm-up exercises are very important. People don't actually give much of an important as they do for weights. So the warm-up important exercises are very, very important, and keep your muscle flexible, active, warm, you
Yes.
know.
Yes.
So that,
Exactly.
and also, yeah,
Warm and stretched before you try to load it.
absolutely,
And
absolutely.
then afterwards stretch it and warm it down. Yeah.
Yes, yes,
Up and down, the stretching just in the middle, strengthening in the
correct,
middle, right? Yeah.
correct, correct.
Let me just the last question then, unless you've got something you wanted to say, mention, talk about. But we've said a few things like kind of important principles and what what would be bad training, or what would be perhaps not the best way to train in terms of if you were just to strengthen prime movers, or if you weren't to do enough on flexibility, or if you were to do a lot of these one-sided sports without anything to compensate for that. The strain wouldn't necessarily come up early on, right? It could be months, years down the line that you found out about this. Would I be right?
Correct. Yes.
Yeah.
It takes it, like your body to respond, like your muscles have so much of a potential to take it in so much.
Right.
So you wouldn't actually show the signs of that muscle weakness or a muscle strain. It wouldn't actually show straight away unless the degree is high intensity.
Hmm.
For example, they are just lifting a heavy weight and if the joint is actually go beyond the range and suddenly unexpected way, then
Mhm.
yes, it is actually, it is nothing in our hand. Definitely it can show the signs and symptoms of a muscle strain and injury. But when it's come to the slow progressive overuse injuries over the long period, like the ACL tear, so the ACL tear in the leg, and also like the clavicular joint, AC joint,
Mhm.
AC joint,
Mhm.
the painters, they
Yes.
don't actually, they don't actually work much of it, but they do a painting a long time, which is a
Right.
repetitive small movement, then can cause calcifications, eventually lead to an ACL joint dysfunction.
Mhm.
So like without a proper balancing work
Mhm.
can lead to a long-term illness and long-term issues.
Yes.
So that it is our duty to just to find out what we need, what's our goals are. Either we have to increase our strength, either we have to increase our flexibility or a coordination,
Right.
because this is all intrinsic factors. One
Right.
one other, everything is merged each other. If you just do the flexibility, strength needed, then you need a joint coordination. So it is all interrelated, so we need to just do a balanced activities. So as you mentioned, the proper way of taking a baby steps.
Yes. Right. Right. And obviously, as individuals, we're all coming in a different starting point, and as you said,
Correct.
to work out what we need to complete all of those areas.
Absolutely. Yes.
Okay. Good. Okay. Well, is there anything else that you would like to mention?
Mm, no, no. So, do you
If
have
we've
any
gone over a
questions?
few things. No, I mean that was. We could keep talking, but we've been speaking for a while, so maybe we'll finish it there, and we'll do this again in the future if people
No
come back
problem.
to some questions. So Pugal, thank you ever so much. If anyone is based in the UK, please, if you need a physiotherapist, he is your man. I
Thank you.
had my sister had a terrible problem with her back, and she was told that she needed to have spinal surgery, and I didn't think she needed that, and would have sent her to India, but it was very difficult. So instead, I sent her to this man, and she has had no problem since. So yeah, you're in
Thank you.
safe hands. Good, great.
Thank you.
Thank you, Pugal, and thank you for today. Thank you for your time. And
No problem.
yeah,
It's a pleasure, Adam. Thank you for inviting me for this wonderful opportunity to teach about like educating people about how this our body system works. And yeah, so you just laid it down the questions in a proper way. So thank you so much.
no problem,
you
no
just
problem. And
you
maybe
just
we'll do
took
this again in the future if it whoops,
yeah.
if it seems right. Okay, you take care. All the
Thank you.
best.
Thank you,
Thank
Adam.
you.
Thank you. Thank you. All right. Thank you. Bye bye.